Welcome, everyone. It is John and Stephen from Tesla Owners of Silicon Valley. We are so blessed to have a special guest, which we are going to introduce to you further today. But Neuralink continues to just raise the bar and make a huge impact on humanity for people that have had, unfortunately, life-changing moments, and or sometimes, things that have limited them on their ability to do the basic things that they used to be able to do. So we're going to get into that all today, but I would love to bring Rob. How's it going?
Good.
Rob Greiner.
I'm here. Thanks for having me.
Yeah, of course. Well, thanks for joining us. So we'll get into this, but Rob is the 6th Neuralink patient. I'm going to pass it to Stephen. Stephen, introduce yourself and tell us a little bit about Neuralink.
Yeah, well, hey, good morning, everyone. Stephen here with Tesla Silicon Valley. And as John mentioned, we have a super awesome guest with us today, Rob, who is Neuralink's 6th patient. Just a quick background on Neuralink, if you don't already know a little bit about it. Neuralink is a company founded by Elon Musk back in 2016. The objective of Neuralink is ultimately creating a brain-computer interface that connects the human brain directly to computers, which is crazy. Neuralink's device, it's a small chip that actually goes in the brain, and it's called the link. It's implanted right there with a bunch of like super ultra thin threads, and those can help read and send neural signals. The technology, ultimately, it aims to help people with neurological conditions like either paralysis or ALS, and it helps them control a device just with their thoughts alone, which is, again, that's amazing. But if that isn't amazing enough on its own, one of the long-term goals, or the long-term goal of Neuralink, is ultimately to be able to connect the human brain and merge it with AI. So again, a little background on that. We're going to learn from Rob and hear a story about how Neuralink is having a positive impact on his life today.
Yeah, and why are we here? It's really to showcase and share the amazing story of how people have been in potentially really bad situations before Neuralink, and how as Neuralink is just getting picked up, because again, Rob is only the 6th patient. We've had the blessing to interview Nolan, the first patient ever, and then also Brad, who has ALS. But all of their stories are super inspiring, and we're so blessed to be here with Rob today. But Rob, just tell us a little bit about yourself. Give us a little bit about your background, and then we'll kind of just grow the interview from there.
Yeah, sure. So my name is Rob. I am a quadriplegic, C3, C4, injury on my neck. I'm from Idaho. Grew up in a little small town called Horseshoe Bend. I'm just a good old country boy from Idaho. Been a dog trainer for most of my adult life. So that was mostly my career, but yeah, that's kind of quickly a little bit about myself before the accident.
Yeah, well, tell us a little bit about. I'll just jump into it just because. But tell us, how did you find out about Neuralink, and potentially, if you would like to, just share the story of how you had the need for Neuralink, and then maybe how you found them.
Yeah, of course. So after my surgery on my neck, I was lucky enough to be able to go to a place called Craig Nelson Spinal Cord Rehabilitation, and there and University of Utah, the hospital there in Salt Lake. And while I was there, I kind of heard of Neuralink by just looking at stuff that can help, quadriplegic, or what's the up and coming science. Because before my injury, I'd never was researching any of that. But then I came across Neuralink, and they're doing trials, and immediately I was like, well, sign me up. I never win anything, so I doubt I'm gonna get picked. But I was trying to get um, on their trial uh, before I even got out of the hospital.
What made you ultimately decide to even consider participating in the trials?
Well, uh, I mean, I guess there's a few reasons, but um, mostly because I've just, I'm here, besides my neck and, not be on the move. I'm pretty healthy for the most part. At least I think I am. Um, and, I feel like it'll give me some kind of purpose, or I'll be able to give back, and then hopefully, you know, something will happen to where it'll bless my life and bless other people's lives, and but yeah, I mean, it was kind of a long shot, but I kept bugging Neuralink until I finally was able to go get screened. But yeah, but mostly it became more of a way to give back. Um, yeah, because Lord knows I was just going through life without probably, thinking of others as much as I should have, and so
Yeah.
yeah.
Well, what was the as you got, obviously you kept bugging them, and obviously at
Mhm.
some point they changed their minds. What was your reaction to that, and also to what was your family's reaction?
Yeah, we're not the most tech savvy people in the world. I mean, my dad is, um, but when when we found out that I was going to get screened, um, that we were all excited, um, and we didn't really know what to think. So when I finally got screened, I got back home, and I was like, all right, well, we'll see if I get a call, and I got the call, and and said that I was chosen, and yeah, the first thing my mom says is, "Oh, we never win anything like that. Our family we're just not lucky like that." So um, even though we're not the most tech savvy people in the world, we just um, knew that this was something important and something that I definitely couldn't just pass up. And change my mind. So everybody was excited.
You bring up a good point too, where Neuralink, again, ultimately, it could be used by majority of the population at some point. But you brought up a good point about how you're not necessarily a tech savvy person. Just kind of a on topic question is: would you say that it's been a fairly easy process of just getting acclimated to the user interface on there?
Um, I would say yes. I mean, I'm not the best at it yet. It's only been a couple weeks, few weeks, but um, yeah, for someone that's not on the computer a lot, or even my phone that much, besides just business. Um, yeah, with it, the way it's kind of like programmed, and then also the people that work there. Um, yeah, it's just like, I don't know. I was surprised how user friendly it is. Um, yeah.
Yeah. Now,
So I
Rob,
think good.
yeah, one thing that I think we haven't discussed yet, I'd like to know is how long has it actually been since you received your implant?
June 6th.
Wow, wow, very fresh, very fresh. Can you
Yeah,
give us, yeah, can you give us a little bit of a walkthrough of just that whole process of, you shared about the application process. Obviously, some perseverance was very much required. But what was the entire experience like from showing up at the hospital to, again, it's only been about a month or so since you received it, just that whole process.
Yeah, absolutely. So we stayed at a hotel because it was just me and my father, and I didn't, bring a whole posse. So we decided to stay in the hotel. And June 6th, I think 5:30 a.m. We checked in, and then before you know it, it was already 7:30, and I was getting surgery, and then I woke up. It was everything was really smooth. Everybody was like, I mean, I'd never had an experience in the hospital that was that pleasant by any means. I mean, that whole process was it was just, it was almost pleasant. Like, so I wasn't scared or intimidated by the surgery at all. I think mostly because of the staff. But yeah, I had the surgery and then I woke up around like 11. So I think it was like a 4.5 hour surgery. They were able to get 123 out of the 124, or wait, 127 out of the 128. The robot was able to, jam it in there. So I was blessed to get, most of those strands. Yeah, then I woke up. So I wasn't able to move my head for 24 hours. So the most I could do was like 20 degrees this way or that way. And so my head was just kind of stuck. And believe it or not, that was probably just the worst part.
Are you awake during the surgery, by the way, or are you asleep?
No.
Okay.
No, that'd be freaky.
Real quick, you said 127 of the 128. What do you mean by that? Do you mean incisions? Or
so the
what
film,
exactly?
the strands that I think Stephen was talking about earlier.
Okay.
They're like, they're so thin. I don't even know how to explain how thin they are. But the robot, the machine initially is the one that puts them in there. So they can avoid, I think, blood vessels and stuff. And the robot was able to get 127 in there. I don't know exactly what happened with the 128th, but they were super happy about it, because I think at least the previous 4 participants, I want to say, I don't know exactly. I know they had half of that many strands. So
Wow.
the surgeons, I remember, they were pretty ecstatic with the result. So that made me happy.
Rob, just one last question on the surgery process. The robot that performs the surgical maneuvers, putting the threads in and connecting it to the brain, is that done using AI, or is there actually a surgeon that's controlling kind of robotically, or remote control almost? Do you know?
Oh, I wish I knew the answer to that. I know I just watched the summer, like the update, Neuralink update, and they were talking about the robot, and I don't remember exactly what they said, but I do think the robot just, is able just to kind of put them in there. I know I've seen like an image of kind of what it looks like, and it looks impossible to do by hand to avoid all those little blood vessels. So, but yeah, I think the robot does kind of the heavy lifting when it comes to the actual insertion process. But I could be wrong.
And you said that you got double the strands. What do you think, like, how big of a deal is that, or what will that how will that enable you even more than maybe the previous patients who only got half?
Well, I think again with the update video that Neuralink put out with Elon there, and I think they were talking about, you know, doubling and then doubling again, and then they're really trying to just get the like the whole brain interface, you know, more strands. I think each strand has like 8 like receptors, or again, I'm not not very tech
No,
savvy, but
no worries.
I try to know my best about what's inside my brain, but I know eventually they just want to keep going, you know. So
Were you using any devices before this, or was this the first type of thing that you've put in to help yourself?
no, I definitely used besides voice command. Um, so right when I got out of the hospital, I think it was like 3 days later, I started college. Um, so I needed something to help me with my classes. Um, so I got this thing called a glass house, and it's kind of like you put it on like glasses, and it kind of works like almost like a Wii remote. So you move your head around, and you know you're with your busted neck, move it around, and this thing kind of goes into your mouth, and you click it, and it's kind of like a left click. Um, and so I used that for a while, and then I also have this quad stick, which is kind of this device that you put your mouth on, and it's got like a few like sip and puff kind of tubes, and you can kind of mix and match. And that's mostly what I would do if I was playing PlayStation, and I got pretty good at that. I could probably fly a plane with that. It becomes like second nature. And then I also got introduced to this thing called uh, augmented, or anyway, it's called a mouth pad. And so I had to go to my dentist, get a 3D image of the roof of my mouth, and then send it to this company. And then I think like 6 weeks later, they ship it out, and it goes up to my roof of my mouth, kind of like a retainer. And then you use your tongue, and you can kind of move it around like a cursor, and then you can kind of click with your tongue. So it's all through the dexterity of your tongue. And I got proficient of all 3 of those, but all 3 of them, you know, they had to go in my mouth, and that that wasn't, you know, the most pleasant thing in the world.
So you shared, so June 6th was the surgery. How long has that actually been since your accident?
Let's see here, December 27th, 2022.
So
Okay.
almost 2 years.
2023, sorry.
Okay.
Yeah,
So,
or 2. Oh, sorry, I'm trying to do the math here. But yeah, it's like 2.5 years now or something.
Gosh. So very much escalating rapidly through the technological realm as far as any of this goes. I mean, just a thought too, as far as what is the difference like from some of those previous technologies you use to actually using something like Neuralink?
Well, I don't have to put anything in my mouth. So no biting things down, no sipping and puffing on tubes. Neuralink it's like you get better and better at it, but like it's almost like it just gets to know you, and eventually it's just so far it's just like evolving with you, and everything gets a lot more efficient. I remember um, writing papers in school, and I'm a history major, so you write a lot of papers. And through oh, sorry about that. Turn volume down. Sorry about that, guys.
no worries. Real life.
I got this stuff. But anyways, so I had to write a lot of papers, and so with the voice command, I could just, you know, blab on and on and on about what I want to say, and then I go back and read it, and I got to edit it. and it's just a nightmare trying to get, a Wii remote or whatever else, trying to find all my typos and, trying to click on it. It took forever. But with this Neuralink already, I can zip around and highlight this, and so it's already better.
Yeah,
And
we spoke with Brad Smith, who's Neuralink's third patient, and I'm sure you probably know a little bit about him. And he has ALS, and I think pretty much his only option, as far as at least what he shared with us, is something called eye gaze, which ultimately required him to sit in a dark room just using his eyes. And he said it was such a painfully slow process. So that it's like as Elon would say, like orders of magnitude as far as improvement goes, but potentially even beyond that. But you mentioned a little bit about PlayStation 5, but what else have you been able to do with your Neuralink that's so far?
Well, I do play computer. I've never really been a gamer, but I try to play some games now. I took turn down volume.
Elon, we're busy right now. We can't have that call.
Man. Sorry, that's unprofessional, but yeah. So I play with my laptop. I actually can play with my friend or my son. They're both really good at video games. My friend Clayton from Spokane, he's definitely a gamer, and luckily he has patience with me. But we try to play some pretty hard games, just to kind of, I guess, put some miles on the Neuralink, so that way, they get more information out of me, and I'm more useful. Just because I did take this summer term off from school, just so I could figure this Neuralink thing out.
When you're playing those games, is it like a first-person shooter? Is it more like, as far as actually your interaction with the game, are you thinking about walking forward and backward? Are you thinking about, looking around and shooting? How is that actually happening?
It's hard. Yeah, it's hard. The first-person shooters, I haven't been able to figure that out quite yet. I'm gonna hopefully work with Neuralink, like, so they can like be by my side, kind of, and I can screen share it, and they can kind of help me figure that out, because it's kind of hard to move and to turn around and shoot at the same time. So a lot of the games I do play are kind of like this game called Baldur's Gate, where it's like it's not so time sensitive, and you can it's like turn based, if that makes any sense.
Gotcha. Yeah, Brad was sharing that he was able to play, I think, Mario Kart with his kids on a Nintendo Switch.
Yeah, racing games are definitely racing games are cool. Yeah, that's awesome. Yeah, I saw that video. That made me happy.
So as far as, that's like the cool end of what's happening with Neuralink, and eventually it may get to the process where you are almost like a Ready Player One kind of a situation. But as far as just your daily interaction using Neuralink, what are you mostly using it for?
Well, so I'm not in school. I got another term, and then I think I get my degree. But so I'm not doing much school, but that's what I will be doing every day with Neuralink. But right now, every day I try to just make sure I'm using it somehow, some way, whether I'm communicating or texting or watching a video or playing games. I try to stay a little active on it. Sometimes I feel guilty because I'm not on it, 8 hours a day. But soon I will be. Yeah. But right now I'm just trying to get pretty proficient at it.
How would you say the device has improved your quality of life or your sense of independence? How long after the accident was it that you got your Neuralink to like work, or it's been a month, so has it been a lot better now? But how have you seen it improve your life even versus some of the other devices you were using?
Well, it's a lot more exciting, because it's only going up, and so the future of Neuralink is just that part is also very exciting, um, and it's just it, it does give me a sense of independence. It's not completely hands-free because I do have to have somebody, you know, um, place this little disc, next to my head so I can connect, like Android. But um, but yeah, it's the next best thing. Um, I'm sure they'll be working on it to where I'll be able to charge by myself and turn it on by myself, and that would be pretty cool. And they're just trying to do a whole bunch. I mean, they're just working on so many things to help other people, which is very important to me as well. And I feel like as long as I'm actively using it with doing anything, I feel like they're getting more information about, interfacing with the computer. And so I think it's enriching my life. Otherwise, I would just be kind of a quadriplegic, just kind of sitting in a chair or laying in a bed.
Yeah.
Yeah.
You mentioned, I think you said it was 127 out of 128 threads that were able to successfully get connected, which is twice as much as the previous first 5 patients. Besides just that general improvement, which again is probably a much bigger deal than it even sounds, are you aware of any other improvements that you've received over the first 5?
No, I don't think I don't think so. Um, uh, I feel like I feel like as far as what I can do, I don't think it's any different. I think just as far as the information and the interfacing, I think that they get more information out of that. But as far as I know, I don't think I'm, you know, got like a upgrade, um, compared to the previous 4 or 5.
So hardware
So
is all the same, probably.
yeah, yeah,
Okay.
the hardware's all the same. It's just they're getting more information. It's exciting. Yeah.
How would you say Neuralink has brought back certain freedoms in your life? I think you mentioned some of that, but what has been the biggest game changers for you personally?
Um. Well, it's like I said before, it's just the excitement of seeing where it's going, and because I believe in Neuralink so much, it's just I feel like that's really just been a big driver, and it makes me excited. You know, not necessarily to be a quadriplegic, but it makes me excited that I'm doing something with at least my noggin, the only thing that I can move right now. So, but yeah.
Would you say that there's some components of life that have more or less say the same as far as Neuralink, implant, pre and post, or have there been some really just dramatic life changes that Neuralink has provided?
Not nah, um, not exactly. Nothing huge. Um, um, like I said before, it's just bringing more excitement to my family, and you know, just watching me get better with it, and yeah, excited for the future. Excited if I can help one human being, totally worth it.
And I guess you'd say it's a much more, at minimum, it's a significantly more efficient process than previous technologies you were using.
Uh, Definitely. Yeah. Yeah, definitely. Not even just because of the, you know, the, the mouth part that goes in your mouth. Someone else has to clean it. And, I hate asking people to do that. I don't, I don't care if they're family or not. It's gross. Um, and yeah, with Neuralink, there's none of that. And I feel like it's it just becomes more streamlined. But like, yeah, like I said before, it's like it's evolving with you. It kind of grows on you, and yeah, every day gets better. I'm
Yeah,
excited.
seems like a huge game changer. Have you been able to take any or get any new hobbies with Neuralink now? Because you said it's been a lot better than some of the other devices that you've used.
Mm.
Have you been able to get any new hobbies?
Well, I play computer games now. Um,
That's
no, I
awesome.
haven't quite. Um, I'll think of something. I'll think of something I can do with Neuralink. I know that our participants have really done some amazing things, and uh, I know I got to catch up. So I'll figure something out. I've just been, your local friendly dog trainer for so many years. But yeah, I am pretty much a full-time student to be a high school history teacher. So hopefully, um, you know, Neuralink will be, well, not hopefully. I kind of know Neuralink is going to be a big part of all that. And
Yes.
I still got a couple years to go until I actually get it. I get my bachelor's, and by then, who knows?
Hmm.
Who knows what I'll be able to do?
Speaking of some of the other Neuralink patients, do you speak with Brad or Alex or Nolan? Do you have communication with them on like a daily basis?
Mm-mm.
Okay.
Brad, though, I talked to Brad um, um, multiple times, and Brad's amazing. You can feel you can just feel his little spirit like through the messages. He's got way better attitude than I do. It seems like, and he's just, yeah, he's definitely um, someone I kind of look up to. Same with Nolan.
Hmm. So
And I
no
haven't really
no
talked
late
to
night
him.
gaming sessions with them or anything?
No, not yet. I'm waiting. I think I've reached out to him, but um, I know he's a busy guy. So um, yeah.
Yeah. As far as again, like I guess not constant communications, but do you ever have any feedback either yourself or kind of as the folks who are using it as far as the trial goes? Do you have feedback that you kind of come up with together?
Mm, what do you mean by that?
So as far as like improvements or feedback or anything that you've kind of like noticed on your end, or Alex might have noticed, or Nolan or Brad, where you're like, oh yeah, these are some of the places that we all kind of see ways that I know one of the most incredible things, and we could talk on it later a little bit more, but even that Brad is actively using Grok all the time.
Mm, I'm gonna have to try to figure that out too. Um, no, I haven't quite. I know I have some questions that I would like to ask other participants if they kind of had the same experience with. Um, but I'll get there. Yeah,
It is so early. So like you said, it's only been about a month since
it
you
is early, but
yeah.
I do want to be part of part of the team. They're all seem like a really good group of guys, and I look up to all of them. Yeah, all five of them. Uh, I wouldn't be able to. I don't think I'd be able to do it without you know seeing seeing how it's blessed their lives.
How do you think, you mentioned, well, so congrats on going through school. Like, we're going to be rooting from you from the sidelines, and to become, I think, a history teacher, and to
Mhm.
eventually obviously go and teach students. How are you hoping to make an impact? And also too, how do you hope that Neuralink enables you to do that?
Well, that's a huge part of why I'm doing this, is to give back. Um, and I hope Neuralink. I mean, I'm going to be a history teacher anyways. Um, if I can finish school, using the other things I had, which is a nightmare, and especially if I'm in a classroom and I got something in my mouth. But I hope the information that I give Neuralink, just from using it, will help, their studies, and hopefully, they'll be able to help other people that have bigger issues than me. I know they're working on a lot of good things, and um, yeah, as far as students, hopefully they can see, that perseverance you know is an important thing. And also my son, I want him to be able to just at least be proud of me just a little bit. It's important to me. Yeah.
I know
But
he will be, man.
yeah, yeah, we'll see.
Yeah,
It's
just
never good.
some parting thoughts. I mean, it sounds like you're saying, one of the biggest outcomes as far as being a someone on the trial, as far as the what's the specific term again? Just trials, I guess, right?
Mhm.
Go is just really making a positive impact, and kind of giving that data back to Neuralink to keep expanding, That was more or less exactly what Nolan shared with us as well, as far as, especially, that it's got to be super nerve-wracking to be Neuralink's first human patient. But he said, he's like, if this helps people, if it helps, like, I think even you said, if it helps just one other person, then it's a mission success on your end. But just kind of basing that a little bit kind of on what John said as well. But what, as a collective, what do you hope to have as your biggest impact, especially now that you have Neuralink to assist you as well?
That the biggest impact to me.
For you, for those you interact with, just as Rob, as a man.
Yeah, I mean, I just being a pioneer, into this crazy tech world and AI. Um, I never thought I'd, want to be one of the faces of it, um, but yeah, I'm not trying not to be camera shy anymore. So, and as far as me, I man, if I can just get one arm, just like one arm, that works and functions, man, I'd be a beast. I'd be getting all sorts of things done. Just one arm.
I was
So
gonna
someday they
say,
can
yeah,
kind
I
of
think,
bridge it.
yeah, Neuralink has shared that, haven't they?
Yeah, I think so. But if they can get a digital bridge, so a chip, below my brain, if we can kind of get my brain and that to talk to each other, if I can get a good arm working, that'll be that would be pretty good. Yeah, might even be able to help some dogs out there too. Um, yeah, that'd be pretty cool. And
Yes.
as far as everybody else go, I mean, I just I'll do whatever Neuralink needs me to do. If they wanted to get another implant, another part of my brain, I'm willing to do that. Um, I'm really, yeah, I'm just giving it up.
Yeah, you definitely sound like a man with a lot of gratitude, and obviously you have so much more that you're going to keep giving as far as the trials go, and it's exciting to know that you already are making an impact, you've made an impact, and you're going to keep making an impact.
Yeah.
I hope
And
so.
one day in the classroom.
Yeah, I
But
hope so.
Rob, thank you so much. I mean, it's crazy how fast the time just flew by. 40 minutes just goes by. But thank you for sharing your story. We will Tesla Owner Silicon Valley will be rooting for you on the side, and who knows, maybe we can have you back on as things continue to progress. But it's crazy how much Neuralink can even give you the idea that, some of these, like the functionality of an arm and all this other stuff, you could get back through it. And so and it's great that also it's restored basic things like, playing video games with friends and other people. And so being able to kind of bring a little bit of that social, even online aspect. And so, but I'm super pumped for you, super excited to see how you go and make an impact in the classroom, and just being a mouthpiece for Neuralink and just talking about what it's doing. And so thank you again for all of that. But we truly appreciate your time today, and we're so excited to be a part of being able to tell your story and sharing it with our audience who, loves to hear such inspiring stories.
Yeah, thank you guys for letting me potentially, inspire somebody. You guys have been great, and appreciate you guys' patience with me, and I try to answer the best I can. But
you did an amazing job.
Yeah, the future's gonna be fun. You can have me on whenever you need me. We'll figure it out. So I'm here for the future. I'm here for Neuralink. I'm here for hopefully helping people with bigger problems than me.
Well, awesome. Thanks again for your time. We've tagged Rob on his handle on X. Make sure you give him a follow. Stay up to speed on his latest updates from Neuralink and how it's helping him. And also, too, safe travels today as you go down for another appointment down in Phoenix. And let us know how all that goes. But we'll talk to you all later, and have a great week, everyone.
Thank you.